Hi, Professor. I would like to know what is positive programming and how we can use positive programming in issues like anxiety, stress, and phobia related issues.
Okay. Say positive programming is a technique in the behavioral therapy. Many issues related to behavior, and nowadays it is increasing day by day. Especially the children and adults, the use of mobile phone also increase the behavioral issues nowadays. Okay. So coming to the point, there are many techniques in behavioral therapy, but this positive programming is one of the most important technique. This is going deeper into your subconscious level. Mind has threefold dimensions: conscious level, subconscious level, and unconscious level. So, mind is so vast, so nobody can understand what is the real mind or what is the mind in its totality. In its periphery, whatever we are aware, whatever we are now thinking and doing, what we say conscious mind. And there are some portions of mind, it is like the deep ocean. We are not at all aware, that we call unconscious mind. And there is a subconscious mind in between. In that subconscious mind, we store the things. And our daily life, we are controlled by the subconscious mind, not conscious or unconscious mind. Subconscious mind is leading us. So, these behavioral disorders like phobias, anxiety neurosis, or any neurosis, the deep rooted cause is in the subconscious mind. This may be happened anytime, maybe early childhood, maybe later childhood, maybe in your teenage or adolescence, anytime something wrong programming is happened in your subconscious mind and you are going accordingly. If in your early childhood some hatred is developed, any kind of trauma is happened, that will be a hindrance throughout your life. Your subconscious mind is programmed like that. So a person, even if a child or adult, if it is a any behavioral issue, anxiety or depression or phobia, what in this programming we do is that person will be given a relaxation. He has to relax in the muscular level, nervous level, then mind level, conscious mind level, and slowly the mental waves, the frequency of the mind waves will be reduced, and gradually that person will be guided towards the subconscious level. This is a gradual process. When he is completely relaxed, the mental waves will be, the frequency will be very less, and his mind will be moved to the subconscious mind. And in the subconscious mind, if you know exactly what is the problem, we will take the client directly to that point and try to give suggestion to dealing or disassociated with that problem. Once again, we take him to that particular situation where it happened, the original cause, and there we make a disassociation with the cause. And sometimes this client doesn't know what is the problem. Okay. So in the normal counseling session or discussion session, the client doesn't reveal because he or she doesn't know what happens. Then the therapist, by his expertism and his knowledge, he will try to find out what is went wrong. He may get certain level, but he may not get exactly. But in the subconscious level, again, there will be like a scanning. Once he has gone to the subconscious level of mind, by the help of the therapist, a scanning will be done in the mind of the client. Then the exact problem will be find out where this is happened. Now, a phobia towards something. Maybe he is phobia towards a spider. So this must be usually happened in the childhood. So take the mind of that client to that childhood and make a scanning and reach the mind into that particular point. And from there, again give suggestion to visualize what happened maybe years back. And in that situation, given suggestion to disassociate, completely disassociate. This is like a surgery in the subconscious mind by giving suggestions and completely giving a surgery, and it is eradicated from the subconscious mind and give positive suggestions and bring back to the client to the normal position. If the issue is not very deep, it is only the issue of some confidence, is lacking confidence to face exam, to confidence and interview. In such cases, there are certain visualization technique. The therapist will give instruction to visualize and bring his mind to that level of visualization and give again suggestion in the subconscious mind. So the client will develop confidence, more and more confidence, by giving suggestion and visualization together. This is called programming. First of all, the negative programming will be removed from the mind and positive programming will be given. Only thing, whatever we give, it is in the subconscious level, because it is much more powerful than the conscious level suggestions what we give in the subconscious level. This is what, in essence, the positive programming. We can do it wonders in behavioral therapy for OCD, obsessive and compulsive neurosis, and anxiety neurosis, even the mild depression and phobias, and all this kind of behavioral issues, but not in psychiatric issues. Psychiatric problems, they have to consult with a psychiatrist.
So, what is the difference between the mild depression and real psychiatric issues?
See, mild depression is the beginning. All the neurotics are called, the neurotic stage is the first stage. Psychotic stage is the second stage. It is become more chronic and more deep rooted. Okay. This is the beginning stage. In psychology says that most of the people are some kind of neurotic behavior. Okay. Most of us have some time or some kind of. See, you must have seen some people are always going and washing the hands again and again, washing the hand, washing the face, or closing the door again and again. This is a common, maybe some elderly people we can see, but they are not psychotic. This is not a psychiatric. This is just a neurotic obsession and compulsive behavior. Like that, even phobia. Some are afraid to spider, some are afraid to ant, some are afraid to cat. This is not a psychiatric issue. This is only a neurotic stage. It's called the mild issues. And psychiatric issues means it affects the brain and nervous system. The system is affected. So they go to hallucinations. And depression also, like there is a mild depression. Mild depression can be with suggestions, proper behavioral therapy and counseling, we can correct the mild depression. But depression goes to second stage, which is serious and deep rooted. There they have to depend on medicine. Psychiatric consultation is needed, and medicine has to be given in the second level. That is a little more deeper and chronic. Clear?
Thank you.